I grew up in Singapore, one of the most densely populated countries in the world. This is a picture of my kids when we were last visiting my family. And as you can see, it's a really urban place. And it wasn't until 2004, when I came to the US for the very first time on a road trip, that I got to experience a very different kind of landscape. One that looked a little bit more like this, where the land and the sky met in a horizontal line without a building in sight. And as you can probably imagine, the concept of rurality would feel pretty foreign for a person like me. But little would I have known that today I'll be talking to you about my research with rural communities in the Mountain West and how we collaborated on ways to address cancer-related financial hardship, which are the direct and indirect costs of cancer, along with the psychological burdens that come with it. And perhaps it's my perspective coming from a very different healthcare system that I found myself asking a question, like, why should the costs of cancer depend on where you live? My name is Djin Tay, and I'm an assistant professor at the College of Nursing, and my research focuses on the psychosocial and economic implications of advanced cancer survivorship and distance as a disparity. But I didn't always start out studying cancer-related financial hardship. I am an end-of-life care researcher, beginning from my pre- and postdoctoral training with my mentor, Dr. Lee Ellington at the College of Nursing, working together with her on her studies with hospice cancer caregivers, to when I joined the faculty in 2020 and began my own program of research, where I studied population data to look at end-of-life health care utilization among advanced cancer patients who were receiving a type of treatment called immunotherapy. And these were treatments that were associated with both the increase in length as well as quality of life, but also known to be very expensive treatments. And it was some of these earlier experiences with patients that I got to experience just how burdensome some of these financial costs could be. And I recall sitting with a patient who was dealing with metastatic lung cancer, and she was only in her 40s, and she was sharing with me how difficult it was for her to think about the future when she was worried about things like how could she pay for her treatment, whether or not she could keep her job, and even things like her student loans. And I recall thinking that for a person so young faced with her mortality, that being burdened with the cost of just simply surviving was just an awful reality. But unfortunately, it's a reality that's shared by many others in the US who experience cancer-related financial hardship. And as some of you may know, the US has the most expensive healthcare system, and cancer is among the most expensive chronic conditions to have. And analyses of a national data set called the Health and Retirement Study have actually observed that almost half of cancer survivors lose their entire life savings within the first 2 years of receiving a cancer diagnosis. And others using the same data set have estimated the loss in wealth for an individual over a period of 8 years, up to 8 years, and they've estimated that loss to exceed $125,000 on average. Funded by the National Cancer Institute's Persistent Poverty Initiative through a collaboration called Hope and Care Together, which represents a partnership between the Huntsman Cancer Institute and Montana State University, our team received funding to conduct an analysis of the Health and Retirement Study to look at cancer-related financial hardship. And our preliminary analyses has found that among any household that has out-of-pocket medical costs, cancer households or households with cancer spend approximately $2,400 more in out-of-pocket medical expenses compared to households without a history of cancer. Unfortunately, we know that the burden of medical costs are not equally borne, and some of the populations that experience a greater financial vulnerability to cancer are the rural populations. And so with this preliminary data, we also observed that rurality was independently associated with a 36% increase in the odds of having any out-of-pocket medical expenditure. And this is important for us in the US because 18% of cancer survivors in this country live rurally. And for the patients that come to the Huntsman Cancer Institute from surrounding states, the majority of those patients live in rural and remote areas. So to give us a better understanding of the patients in our catchment area, particularly those living rurally who also face cancer-related hardships, we conducted a survey among patients and caregivers. And our respondents had reported that 76% took money out of savings, 64% took on credit card debt, and 18% considered bankruptcy as a result of cancer. And when we look at the qualitative data, we get a clearer understanding of some of the unique challenges faced by our rural communities. Challenges such as driving hundreds of miles for your cancer treatment or procedures or follow-up care, having to worry about things like, do I go for my surgery or do I brave hazardous winter driving conditions? Constant worry about escalating costs of gas, vehicle maintenance, whether your vehicle might break down on the way to the cancer center, or if you might hit an animal. And for those who have livestock back home, who's going to be available to take care of their animals because that represents their livelihood? And combined, these are what we call the indirect costs of cancer, which are summed up really nicely in a quote that I like to share from one of our community advisors. That it's just the time commitment to that traveling, the miles on the road that create this work deficit and this car deficit and this lodging deficit. But unfortunately, financial navigation programs are really not well designed to handle the indirect costs of care rather than handling your medical bill. So to address this gap, our team received funding from the Rita and Alex Hillman Foundation to partner with rural cancer patients and caregivers across the Mountain West, as well as our nurses and financial advocates here at the Huntsman Cancer Institute, and our national partners, Triage Cancer and the Patient Advocate Foundation, to bring together all the information that people will feel that was important for them to have in one place. And this is what we call the SAFE Toolkit, or the Self-Advocacy for Financial Empowerment Toolkit. And it is our goal that with this resource, that people will feel prepared to have the information they need to make informed decisions about their financial decisions across the cancer trajectory. Of course, we know that everybody's financial situation is different, and that dealing with complex information like financial resources can be overwhelming, especially when you're dealing with a cancer diagnosis. So to address this issue, our team received funding from the Digital Health Initiative to translate our toolkit into an artificial intelligence-enabled chatbot. And this allowed us to deliver this information in a more individualized, responsive, and humanistic way. And it is our hope that this paves the way for other such applications in the future. And at the same time, this allows us to ask different types of scientific questions, like how does artificial intelligence enable people to navigate some of the most difficult financial challenges in their lives? Of course, none of this could be possible without the collaboration of some of the most wonderful people that I've had the privilege to work with, who each bring their diverse perspectives and expertise, ranging from the fields of biomedical informatics, health economics, and cancer care delivery and cancer communication, just to name a few. And I feel very privileged to work with all of them and leverage the resources of our institution, partnering with our community partners and lending my nursing perspective to combine compassion and innovation so that we can deliver solutions that address equitable, and accessible care for the patients that we serve. And it is my hope for the future that no matter where you live, be it in a rural or an urban place, that you would never have to ask yourself, why should the cost of cancer depend on where you live? Thank you.